Hi there, I'm Jessica, and I'm going to present my complex problem multimodal presentation today to you about the opioid epidemic in Ohio. If you'll bear with me here, I'm going to put this on the full screen. There we go. Okay, so I chose the problem of the opioid epidemic in Ohio. I started my presentation with a nice little quote from Hippocrates because this is geared towards healthcare professionals and providers who can prescribe medication. I thought this quote was applicable. Wherever the art of medicine is loved, there is also a love of humanity. So the opioid epidemic is a complex problem in nature. It requires basically an interdisciplinary insight from not only medicine, but law and criminal justice and the medical field and things like, the abuse and overdoses and deaths, things we think of, but also law enforcement and the judicial aspect of things. And we also know about the societal implications of it with families and how it affects friends and relationships, children in foster care, things like that. But I propose that we look at the problem as well through a humanities and social science lens because it can give us a deeper understanding and insight about the problem and kind of help get to the root of the problem, which the other disciplines and aspects that I just mentioned haven't quite figured out. So Ohio is number 2 in the nation for overdose deaths for opioids, and this is data from the World Population Review. This is an interesting infographic that shows Ohio as the second, only to West Virginia. Per 100,000 deaths, Ohio has, I think it's 49. So how does this involve you, the healthcare provider that I'm speaking to? As a provider who can prescribe medications, whether you're a doctor, a nurse practitioner, physician's assistant, whatever, you are kind of one of the first entry points when you prescribe opioids post-surgery. And now that, we include pain as the 5th vital sign, it's something that we try to manage appropriately while addressing pain, but also not contributing to this epidemic. It's hard with the ubiquitous presence of opioids everywhere, especially in the mid-90s when Oxycontin came out, and it was touted aggressively as risk-free, and it's our, best thing since sliced bread. So I will kind of talk about that. We're not exactly to blame, we have fueled it, but there are some contributing factors to this epidemic. All right. So a little bit of the history of opioids. We all kind of know that opioids came from the opium poppy seed, and in 1805, the isolation of morphine came from that. And then morphine has become the standard for over 150 years as, what we prescribe for post-op pain. But it requires repeated administration. So every 4 hours, a patient must take it in order for it to work. So that has led to tolerance and dependencies. So Purdue Pharma came out with Oxycontin around 1996, and you had to take it less often throughout the day, and it worked on the pain better. So part of the reason that this fueled the epidemic is we were told it was low risk, so we basically liberalized our prescribing practices. And by 2005, opioid abuse and deaths exceeded those of heroin. And then between 2004 and 2012, 80% of patients post-surgery were receiving opioids. From 2010 to 2012, the nationwide scale back happened where we were told of all of these problems and overdoses, so we scaled back our prescribing, and this in turn led to an increase of illicit use of heroin and fentanyl. An interesting fact is in 63% of overdoses, the patient had used another central nervous system depressant, such as a muscle relaxant or alcohol, and they also had a psychiatric disorder. So there are some obvious risk factors that we know about with an opioid abuse habit or overdose, we're finding out that obviously we know there's a pharmacologic aspect of opioids, why they're so addictive. And what hasn't been studied as much is the risk factors as far as economic and cultural. So I'm going to talk about those today so they can provide a little bit more of a holistic understanding of this whole problem and help inform us of our better prescribing practices. So, risk factors we all know we're aware of. The pharmacologic reason in our bodies, in our brains, that opioids are so addictive is it activates the reward system. We know that leads to cravings, and then that can lead to abuse. This can also be perpetuated if there is already underlying psychiatric disorders in the patient, such as depression, anxiety, bipolar. And then we also know that because somebody is abusing this, it leads to tolerance, and tolerance leads to them taking more and more and more. And eventually your respiratory system, because it depresses it, will eventually stop breathing. So that's how we know that that happens in the body. However, there are also economic risk factors about the patient. So this is where you have to consider the patient's economic background and understand where they're coming from. So something that I learned is that there's these pressures of a neoliberal economy, which is what we have here in America, where it's merit-based and one must constantly perform at their best, which means you must eliminate all performance insufficiencies as soon as possible and get back to work, i.e. pain. So this leads to going back to work too soon because there's this pressure to be a good worker. And if you need to go back to work too soon and you're still in pain, you're going to turn to stronger pain meds. And that is more likely to lead to abuse and overdose, as we have found out. So there's also this risk factor of a cultural aspect. So you have to consider the patient's cultural background. So a lot of patients, especially blue-collar workers, their identity is tied to their personal, physical, and economic achievement. So the human body is kind of considered the capital, and it must be maintained at all costs. So specifically for those patients who have hard manual labor jobs or lower socioeconomic levels. Also consider the patient's mental standpoint, like if they have a very pessimistic outlook on life and they have a lack of hope in the future. Here is a perfect example of why Ohio is affected so much. Certain geographic regions, like Appalachia, Ohio, West Virginia, we're finding are more affected. And that could have something to do with the culture. Like I just mentioned, the body is the capital. We've got to work hard, and it can be intergenerational. So if, your father was a hardworking farmer, you're a hardworking manual labor person, that's how you find your identity. And so you must continue that at all costs, or else you don't know who you are, right? So then you go back to work too soon if you have some sort of injury, and you turn to pain meds, and the slippery slope continues. I also found out in my research that it can be contagious. So drug addiction, if you're surrounding yourself with people who are on drugs, you are more likely to become addicted to drugs, especially opioids. And here I go again, talking about why Ohio. So Ohio specifically is a high output manufacturing state. Lots of factories we had back in the 40s, 50s, and 60s, and then the economy died in the early 70s. And this led to a lot of high unemployment. And high unemployment means you're not working, and you can get depressed, you can be very pessimistic about the future, and that's just a fertile environment for drug abuse. We also have two major interstates, probably more than that, but the ones that I can think of are I-75 and I-70 that crisscross throughout the state, which is leading to easy, ready access to illegal drug trade. These trucks are full of drugs, and they can get them very easily to and from and through Ohio. And of course, Ohio has a willing audience for that, and that is blue-collar manual labor workforce. So the practical implications of what I just described for healthcare providers who can prescribe medication is that you should consider family history and associations and social ties of the patients with affected people in their lives who are on opioids. So that's a question that should be considered. It's kind of tricky to go about asking that, but it's important. Use your ethical judgment to keep prescribing to patients of departing or retiring doctors. I found in my research that that's a lot of the well-intentioned and very good doctors may not have realized that when they took over a practice, they continued to prescribe these opioids, leading to and fueling this epidemic. And also just be holistic in pain management. When you're trying to figure out what to prescribe to a patient, consider everything, not just their pain, but also their economic situation or their cultural situation. And thanks so much for listening. Here is my works cited.